Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sinise. We meet every Saturday at 10:30 a.m. Central Time. And if you're watching us live, we're on YouTube and Facebook Live every week. And you can always watch our on demand by going to our UroPatient.com website, where you'll find all of our past episodes. Also, the best place to go to get any of our handouts. We've got a bunch of them, so go and check those out. Every program I put out, I have a handout with valuable information for you guys. So let's get started with our show this week. And hey, great show it is. We're going to be talking about testosterone replacement therapy. A lot of controversy and concerns about this, but we're going to try to help you demystify it, understand the symptoms, the risks, the treatments, and we're going to talk about that right now. So testosterone is often called the male hormone because it's primarily produced in the testicles and affects many aspects of men's health. While it's normal for testosterone levels to decline gradually with age, some men experience a more dramatic drop that can actually impact the quality of their life. Now, low testosterone can manifest itself in various ways. Physically, you might notice you are more tired than usual. Might notice that muscles aren't quite as big or strong as they used to be. And you could put on a few pounds. Don't we all do that? More important, though, especially is around the midsection. We kind of call it the apple belly syndrome. As you kind of start to look like an apple down there, you have all this fat. Now, one of the side effects of all that fat is it can also be a source of estrogen, which competes with testosterone. So it's kind of like both problems. Low testosterone can cause weight increase. Weight increase can cause higher estrogen levels, which can then lower testosterone. So it can be a mess. Emotionally, you might feel down and irritable. And sexually, you may experience a decrease in libido or difficulty with erections. Interesting thing about testosterone is it affects your sex drive, which can then affect your erection. But you don't need to have testosterone to get an erection. There are several reasons why testosterone levels might decline. Aging is probably the most common cause, but conditions like diabetes and obesity can play a role. We talked about that. Injury to the testicles or treatments from other medical conditions can also impact your hormone levels as well. Now, don't just automatically assume that this is an older man's disease. We see some guys in their 30s, 40s with low testosterone, so it should be worked up. So, how is low testosterone diagnosed? If you suspect you have low testosterone, it's essential that you get a proper diagnosis. Now, this typically involves reviewing your medical history, a physical exam, and then blood tests to measure your testosterone level. Important thing about blood testing for testosterone levels, it should be done in the morning because your testosterone has a kind of a natural rhythm to it and it drops off during the day. It's highest in the morning. Testosterone replacement therapy is designed to restore your testosterone levels to a normal range. Now, unlike the bodybuilders that, take it to try to really build up muscle, we're just trying to get you to what you should normally have, because we all read about all the dangers of taking, testosterone supplements, but that's when people are taking this at much higher dosage than they should. There are several ways to administer testosterone replacement therapy. These include injections, gels, patches, and pellets. They all have different ways to work, but they do the same thing. Each method has its pros and cons, and we'll discuss that next. So what are the benefits? Many men will report feeling more energetic and in a better mood after starting testosterone replacement therapy. You might also notice an increase in muscle mass, maybe not quite like this guy, as well as improvements in your sexual function and libido. Remember, I told you it's responsible for that sex drive. Now, while TRT or testosterone replacement therapy can offer significant benefits, it's important to be aware there are potential risks. Common side effects include acne and sleep apnea. There are also more serious risks such as cardiovascular issues and effects on your prostate health. That's why regular monitoring with your healthcare provider is crucial. One of the big problems, sometimes the red blood cells can actually be increased and you have too much red blood cells, and that can be dangerous because too many could cause a clot or something to form. So it's important that if you're being done, having testosterone replacement therapy, that you're being monitored. So it includes testing such as what's your blood count doing, what do your RBCs look like, checking for any issues that could affect your prostate. Testosterone can stimulate prostate cancer to grow. It doesn't cause prostate cancer, but it can stimulate it to grow. So if you had, an early prostate cancer, the last thing you want to do is throw, gas on the fire by giving yourself testosterone supplements. Now, all your physicians that are taking care of you are going to do a great job of monitoring for all that stuff ahead of time. So it's not for everyone. It's typically recommended for men with clinically low testosterone levels and associated symptoms. That's a change. Early on when they started noticing that levels were low in men, they started treating everyone because there was some thoughts that it could improve cardiovascular health and all sorts of good things. Studies have not really completely supported that. And now it's felt that you want to treat people that have a low level, but also are symptomatic. And we talked about all those symptoms earlier. So your healthcare provider will work with you to determine if replacement therapy is the right option based on your individual needs. Once you start replacement therapy, regular blood tests are necessary to monitor your testosterone levels. You don't want them too high. You don't want them sub-therapeutic. Treatment may also need to be adjusted based on your symptoms and side effects you experience. Keep an open line of communication with whoever your healthcare provider is throughout the process. So there we have it, folks. That's a little snapshot of what you need to know about testosterone therapy. If you're having symptoms and you think it might be something affecting you, be sure to go see your healthcare provider, and you may need to have testosterone supplementation. I think in a future episode, we'll go into this in greater detail. I'll go into all those different treatment options, but this is a nice little quick intro. So be sure to join us next week for more information on the UroPatient podcast. Have a good rest.